I'd like
important plenary of this conference, and that is to be delivered by US Congressman Dr. Jim McDermott, who has been a champion for the cause of HIV/AIDS. He was chairman of the Global Commission on AIDS, which was started by the US government, and he remained chairman for several years. Between 92 and 2004, he has traveled several times to India. He had toured red light areas. He had seen the initial work of ART centers, initial work of the pre-ART center era where the testing was there, voluntary counseling testing. And he made wonderful projections by sitting with people like us during that time, and his projections became very important. So we just Google, his conference is not sponsored by Google, but we always say Google. Dr. Jim McDermott and HIV/AIDS India, you will find several of his publications with his name as authors, and he has been champion. Dr. Jim McDermott, please.
Good afternoon. Good afternoon. I mean, I thought maybe you'd gone to sleep after lunch. It's a great lunch. It's a pleasure to be here among such distinguished company. The level of collective medical knowledge and expertise in this room is truly impressive, and I'm honored to be included. Now, you'll notice there are no slides, because this isn't a scientific speech. I'm not going to give you slides. I'm going to give you a doctor who's been involved in politics and in the whole global thing over time. I want to thank the AIDS Society of India for this warm invitation and their generosity. I especially want to thank my old friend, Dr. Galata, who's a true pioneer in HIV research. I met Dr. Galata in 1990 on one of my first visits to India, back when we were all just beginning to grasp the gravity of what the HIV epidemic was really going to do. We both knew at that time that the official estimates of only a handful of AIDS cases and HIV-infected people in India was really a categorical denial that given India's sheer size, the country was sitting on top of an AIDS volcano, and that would soon erupt. Dr. Galata deserves enormous credit for the foresight and tireless efforts to bring international attention to a crisis that no one wanted to talk about or even acknowledge existed. I was invited to this conference to speak not only about the global early efforts, but to receive a Lifetime Achievement Award, which I received earlier. When Dr. Galata told me about the award, I admitted I was a little puzzled. And I thought to myself, there must be somebody more important to give that to than me. The way I see it, I'm a child psychiatrist from Seattle who got into public service because I wanted to end the Vietnam War and provide quality health care for all Americans. That's how I got into politics. I certainly didn't do anything directly to get involved in this recognition. I'm humbled to be here with such a talented group of people who have done enormously important things over the last 25 years. The truth of the matter is I didn't go looking for the epidemic. It found me and it stayed with me all these years. While the global community has made enormous strides over the last 30 years, addressing the transmission and management of this illness, AIDS remains an ever-present struggle against our best efforts at education, research funding, and perhaps more importantly, compassion. I have to say here, AIDS is a political disease as well as a medical scourge. And if one fails to see that political aspect to it, you will not understand the difficulties we're really still in. You're all very experienced doctors and practitioners out in the audience, researchers, civil society activists, and government officials. You know the history of the epidemic in India. And I'm not going to spend my time telling you all the ins and outs of what's gone on here. But I do have a couple of perspectives to offer to you about what's going on as I see it in the future. I'm both a physician and a member of the United States Congress, and it's through that lens that I had the opportunity to witness the birth of the AIDS epidemic, both at home and abroad. I was a doctor and a state legislator in Seattle, one of the 3 cities hardest hit by the AIDS epidemic in the very, very, very beginning in the middle 1980s. I watched hundreds of young men suddenly get alarming symptoms of a disease we had no diagnosis for, and eventually dying because we didn't know how to treat them. It was clear that we had a real problem on our hands. I was there in the state legislature, and then I left and went into the Foreign Service. As a medical officer, I was based in Kinshasa, which was the epicenter of the epidemic in Africa. The AIDS program was there, and Jonathan Mann, all the greats of the epidemic early days were there at that time, and I was responsible for AIDS education and mental health in all the embassies south of the equator. So I saw everything from Gabon to Somalia to the Republic of South Africa. I had 26 countries. And I saw the ravages of the epidemic at that point all across the continent. By the early 1990s, I realized that Asia was also headed for the same thing because the same conditions existed in other parts of the world. When I was elected to Congress in 1989, I took these experiences and decided to make it my mission to do everything I could as a public figure and as a policymaker to raise the level of concern and awareness among my colleagues and the public, both in the United States and abroad. No one was interested in the AIDS epidemic in 1989 in the United States. There's some scientists here and there, but politicians weren't interested because it was the gay community, and we didn't care about them, and they were doing it to themselves, so we'll just, whatever happens to them, it's not a problem. What they refused to see was that it was a heterogeneous disease that was operating in the rest of the world, both among men and women, and it was going to be a real epidemic. My mentor in the House at that time was a man named Tom Foley, who was the Speaker. And he gave me essentially this job to go out and look at the world and come back and tell him what was happening in the AIDS epidemic all over. So I started in Africa, and then I came to Asia, and then I went to Central and South America. I really looked at the whole world in doing that, and over a 4-year period, I wrote him a long piece about what was going to happen and how it was going to happen. The most interested people in the United States government at that point was the CIA. The CIA wanted to understand how much disruption there was going to be in societies all over the world because of this epidemic. Now, when I arrived in India in 1990, I had just come from the Philippines and from Thailand, and I got here, and it was clear to me that it was already here, but I was immediately told by the government that they had 5 active cases in 1990, 5 active cases. Somebody looked me right in the face and said, 5 active cases, when they're all from someplace else. One of them's an African diplomat who died, and we know that case, and that was all they would admit in 1990. Now, when I asked the question about prostitution in India, they said, oh, well, there's no prostitution in India, it's against the law. I don't know if they thought I was an idiot or exactly what they thought when they said that to me, but they told me this. They said there were no gays in India. I was told that in a meeting here in Mumbai. And when I left the meeting, I was going outside, and a young man handed me the newspaper from the gay organization here in Mumbai. So everything I was told by officialdom in this country was a little off the mark, shall we say. At that time is when I met Dr. Gelada for the first time, and we were working together on this, and he knew, and I knew we weren't being told the full story. So he said, tonight we're going to go have a little field trip. So he had the pleasure or the responsibility or whatever to take me down to Falkland Road and walk down through the red light district. I saw the red light district. I went up into the brothels. I saw how people were living, what was happening in this city. And it was clear not only did they have prostitution, it was thriving. Now, given this information, it wasn't hard to realize that using a simple calculation, you don't have to be a great mathematician, based on the number of prostitutes and the rate of infections and the number of sexual contacts each night, that the potential for new infections in Mumbai was enormous, that the sex industry was thriving and it was spreading the disease at an enormous rate. I made an estimate at that point that there were about 500,000 cases in India. It got into one of the news magazines in the United States. When I came back the next time, the Indian government said to me, "How did you know?" I said, "Because I got to add and subtract. Because if you know the rates and you see what's happening and there's a 30% infected rate and there's a 1% and so forth, then it's easy to figure out what was going on." But nobody wanted to see it. Because as politicians, if you see it, then you have to do something about it. If you don't see it, well, then there's no problem, right? Now, this gross underestimation of HIV and AIDS in the 1990s was in fact partly due to lack of reliable data. The public health infrastructure was just beginning to gear up to monitor HIV/AIDS. It was complicated by the awareness, or lack thereof, of the different communities and their vulnerabilities to the epidemic. The business community didn't want it to become known worldwide that there was an AIDS epidemic going on in India. The Berlin Wall had just fallen. Manmohan Singh and Narasimha Rao were just opening up the economy, and they wanted business to come into India, and here they've got an epidemic on their hands. So they were also not very interested in all this. Well, since those early efforts with Dr. Galata to assess and raise awareness of the epidemic worked to stem the tide of infections between participants in the sex trade has yielded great successes over the course of time. Watching some of the slides in the earlier meeting, it's clear. In addition to that, the use of condoms has made the control of STDs more possible. So there's been, since I was first involved here in India. Another early challenge was the injection drug trade. Back in the 1990s in India, I was warned that I warned them because I knew from the United States what was happening, that communities with high injection rates would be particularly vulnerable to the HIV transmission. And sadly, that situation is still true in the United States as well as here in India. We are still struggling with needle exchange and some of the ways in which we try to control the epidemic in the United States. Now, after that first trip to India, I went home, concerned by what I'd seen, but also with a deep love for India. I lost my heart here. And there was a renewed commitment to be an active partner in trying to help this third world, as it was, the undeveloped world, deal with this epidemic. I knew Dr. Galata, and I knew he'd need some help, so we started in the United States working to put it together. The first thing we did, we formed a congressional HIV/AIDS task force. And I could not get members to come and travel to places like India to look at the epidemic. They simply didn't want to go see it. So I brought people in to Washington, D.C. We spent about $250,000 bringing a big conference like this to the United States Congress. Out of the 435 members in Congress, only 10 showed up. So it tells you where we were when we started with this a long time ago. Now, here in India, I found a partner in the CII, the Confederation of Indian Industries, because they knew that if their workers got sick and died, they lost a worker and they had to train somebody else. So it was an economic thing as much as a human thing. They were interested in having good workforce, and so they began an education project which is going on today. It is the understanding that you have to educate your people about their health status and how they can prevent themselves from getting sick is an important issue for industry as well as for government. The Confederation of Indian Industry has committed itself to its fight on HIV/AIDS, and two decades later, they're still doing what they started some time ago. Now, it's also important to highlight the effect that the CII's work has had on the fact of stigma, because stigma is a real problem. I've dealt with people in South Africa on this issue as well as in India, and the idea of sending somebody to the AIDS clinic sort of puts a stamp on their head that they're an AIDS person. And people are reluctant to get, and you heard in this last presentation by Dr. Singh, the whole idea of how you get people to admit and live with this chronic disease we now have. That is something that CII has been working on, and thankfully we're beginning to make some progress in the whole question of how we reduce the amount of stigma that goes with this. Now, in the early years of the disease, we were scrambling to find drugs. Everybody was trying everything, and there were drugs being tested everywhere in the world, and we began to find some that worked. But of course, you have only a little bit, so who do you give it to? And we worked on mother to child transmission, a very important area. If you're going to clean up the population, if you're going to produce an AIDS-free generation, you have to stop transmission from mothers to children at birth. And so AZT was originally used mostly for that. Now, while we were doing all this, there was still people who thought we could have a cure. I know enough science and was involved in knowing quite a bit about what was happening in the early days. And the AIDS virus itself is a very elusive organism. And we have not yet developed a vaccine. I was approached by one of my friends here in town, not here, but he was from the United States, but he came to me and said, we need some money for a vaccine. And so I said, well, let me think about it. At the same time, of course, more and more of the AIDS drugs were coming online, and government said they didn't have the money for buying the drugs, and the drugs were very expensive. As Dr. Jalata said earlier, the cost of a treatment for a year was around $10,000, something like that. And most governments that's just simply out of the world. Well, India was the first country to recognize this problem and confront it head on. Earlier, they'd been denying the epidemic, but when it came to the production of pharmaceuticals, they came right at it head on, and it was incredible to watch doctors and scientists and the business community work together to dramatically lower the price and increase access to life-saving drugs. The Indian generic drug industry has been so successful that by 2010, Indian manufacturers accounted for 80% of the volume of antiretroviral drugs used in the world. That's how much you have to be proud of and what has been accomplished here. It's not all bad. There have been some really good things come out of this country. In the last 2 decades, India has gone from denying the disease to being a leader in production of the treatment for it. Now, what has happened with the introduction of drugs is another interesting phenomenon. It used to be a death sentence if you had AIDS. That's it. You got it, you're dead. It's just a matter of when. Now, AIDS has become a chronic disease. And I often analogize to diabetes. Diabetes is a chronic disease. You're going to have it from now till the time you die. So you're going to have to treat it every day, and you're going to have to think about it, and you just can't say, well, for a week I don't think I'll do it, or I don't like it, or my mother and father don't like me, so I'm not going to take my drugs, because you're going to get into trouble. And that's the same problem we have with AIDS today is that people, it sort of dropped off the radar screen, and people no longer think of it as a death sentence. It's just a chronic disease, and kids take drugs and blah, blah, blah. Men and women take drugs, and there's no problem. That means then politicians don't respond to it. The money that we got early on for PEPFAR and for the Global Fund and for these major research projects that are going on all over the place was because it was high up on the radar screen and people were seeing it. And so one of our problems today is how to keep it still up where people realize AIDS hasn't gone away. I mean, you'll find people who think, well, it's no problem anymore because they never heard of anybody dying of it. Not like it was 20 years ago when you were going to a funeral twice a week for somebody that you knew. And as I'm preparing, I'm leaving the Congress, and I'm going to hand the baton for this to some other people. I'm mindful of a real problem that faces us, and that is this. We now have not found a cure, so we are locked into forever, as you saw from some of these slides before me, treating people. I spent a lot of time with the IAVI, which is the International AIDS Vaccine Initiative, trying to develop a vaccine. I went to the Gates Foundation and got them to give money in the early days to this because I believe that ultimately we need a vaccine. I want us to get a vaccine. And thankfully, the Gates Foundation has continued to put their efforts behind it and push to do it internationally. Now, the whole business of AIDS vaccines it requires foresight and a long-term resource commitment to advance understanding of HIV, AIDS, and vaccine development, and to train a new generation of scientists who can dedicate their careers to this long fight. One of the problems in the United States, which you're seeing right now as you're watching us, is to say to yourself, are they still as committed to research as they used to be? And you're seeing people, our money going to the National Institutes of Health and other places is gradually reducing. So it is a fight we're going to have to make those long-term commitments. Governments, politicians like to have things they can snap their fingers and fix and move on to the next thing. AIDS is not that way. AIDS is going to be there as long as human beings exist. And that's really the funding for sciences and public health programs is a challenge both for the United States and for India. And the Indian government's got their demands to do other things. And so there's always this tension about something that is going to be much more costly if we don't deal with it in a preventive way than if we wait for it to become a full-blown drug-resistant epidemic. Then we've really got a problem on our hands. We're approaching that in some parts of the world on tuberculosis today, and we don't want to do that in AIDS. Now, as I look out there, being here today makes me hopeful. Veterans like me who faced off the AIDS epidemic for about three decades are glad to see a new group of leaders and people who are pushing. We faced similar challenges fighting the AIDS epidemic before, and I think of a book I read about India. I've been to India 27 times. I've been in almost every state in India except the Northeast. And I read a book one day about called India Unbound by an Indian author by the name of Gucharan Das, who described India not as an Asian tiger, but as an elephant that moves forward a few steps and stands and looks around and looks and thinks about it and then moves forward again and slowly moves. And the irresistible force of the Indian intellect and creativity has much to offer to the world in the future. Gandhi gave a quote that was it's always been my favorite quote, which is, "You must be the change you want to see in the world." And that's really why I was pleased to be offered or given this award by this organization, because you can make the change that will change the world. And it will require persistence and pushing, but I know you can do it. Thank you very much.
Thank you, Dr. McDermott, for giving excellent ideas and hopes that, yes, you can change. Now I'll invite any questions from the audience. Since this is plenary session, yeah. If anybody wants any clarifications or if they want any other information, they can ask outside. Thank you very much.
I would request Dr. Gilada to felicitate Dr. Jim.
This is for you to carry to Seattle, if they allow you.
I request Dr. Gilada to felicitate ma'am, Dr. Keskar. Thank you, sirs. Thank you, ma'am. The next session will be chaired by Dr. Jim and Dr. Keskar only. Ma'am, I'll request you to chair this session.